My name is Elaine Hyshka, and I'm an assistant professor in the School of Public Health at the University of Alberta and the scientific director of the Inner-City Health and Wellness Program at the Royal Alexandra Hospital here in Edmonton. It's an honor to be named this year's recipient of the CHR Institute of Population Public Health's Trailblazer Award in the early career category. And it's especially nice to be recognized alongside amazing public health researchers who are having an impact on population health both nationally and internationally. In lieu of an awards ceremony, I was asked to make a video briefly describing my research in public health advocacy. On top of the COVID-19 pandemic, North America is currently in an unprecedented overdose epidemic that killed over 11,000 Canadians and 136,000 Americans between 2016 and 2018 alone. This epidemic is so severe that for the first time in 4 decades, life expectancy in Canada has stopped increasing and is actually declining in the United States. These statistics clearly show that how we approach illegal drug use in society is not working. Responding to the epidemic, improving population health, and achieving health equity will require us to address multiple health system and public policy failures that are compounded by stigma and discrimination against people who use substances and those living with substance use disorders. My research addresses this challenge by advancing a public health approach to substance use that shifts resources away from criminalization and punishment towards evidence-based treatment, prevention, and harm reduction interventions. I work alongside multiple community-based organizations, health system leaders, and a large advisory group of people with lived experience of substance use, poverty, and homeless. And together, our work has had impact in 2 main areas. The first has been on expanding and scaling up supervised consumption services in Alberta and Canada through epidemiological and implementation science research. And the second has focused on transforming how healthcare systems respond to substance use. In particular, we've conducted a number of studies that have sought to optimize the implementation of harm reduction services like sterile supply distribution, naloxone kits, and other strategies for acute care hospitals. We've also been able to study health authority policies on substance use and positively reform them to improve care and outcomes for people who use drugs. Beyond research, I've also worked with multiple levels of government to shape public policy. Highlights here include serving as the co-chair of the Minister's Opioid Emergency Response Commission in Alberta, as well as working with Health Canada to help support the implementation of safer supply pilot initiatives. I'm indebted to many mentors who have shown me how to have a policy impact with my public health research and advocacy. And in particular, I'd like to acknowledge and thank Dr. Tanya Bubala and Dr. Shanthi Johnson for nominating me for this award. I'd also like to thank the peer review committee for selecting me. I will endeavor to live up to this Trailblazer Award for the rest of my academic career. Thank you so much.